Hi, I'm Dr. Nick Seacrest, and today I'm going to talk to you about something we commonly see in our office. That's usually someone's first visit to us or to see a chiropractor is because they have low back pain. Now, chiropractic, we've talked about in some of our other videos, helps with a wide range of differing symptoms that someone might come in with, but low back pain obviously is one of the most common reasons people do seek out chiropractic care. So uniquely, what do we do? I'll demonstrate that in a moment, but before I do so, there's a few different reasons why. You may have heard someone that bends over and picks up a piece of paper or is lifting something fairly light, and all of a sudden they report that their low back went out. And what is it that happens? If they didn't have low back pain before and they didn't necessarily have an injury, how does that happen? Now, really briefly, what one of the answers is to that is that we accumulate tension kind of beneath our conscious radar. We don't necessarily day-to-day feel pain, but just sitting for long periods of time creates wear and tear on the spine. It compresses those lumbar discs. And over our lifetime, fall on the tailbone, things that we have forgotten about in our youth growing up, those little micro traumas and injuries and postural wear and tear on the spine, it can lead up to that event, even though it might be pretty minor, where it is like the straw that breaks the camel's back. So I'm going to show you today a couple of different things that I do to help bring somebody around that's in a lot of discomfort in that area. So this is Leah, our office assistant, and she's going to help me out. I'm going to demonstrate some of the different things that I do for an adjustment if someone comes in with an acute low back issue. So Leah, I'm going to have you lay face down. Now, one of the things that we check, of course, are the lumbar vertebra. There are 5 lumbar vertebra, as well as the pelvis. You have our 2 hip bones, and then the sacrum sits in the center of the pelvis. So most commonly, if someone's low back, where they report like their low back goes out, or they're kind of stuck in a certain position to one side or the other, usually it's because of a lot of tension within the lumbar spine. Now, what I check for, I do a series of muscle tests, and so I'm going to have Leah bring her leg up. Now, when I'm doing a muscle test, I'm pushing against Leah's leg. Our brain is telling the hamstring muscle to contract, resist my pressure. If I contact an area that's out of alignment on Leah, Leah's brain is going to try to process that stimulus at the same time it's telling this muscle to hold strong. And at that moment, the muscle will test weak where it should hold strong. So what we're going to do is we're going to test the lumbar vertebra for their alignment. So I'm going to go down each lumbar vertebra. I'm going down L2, L3, L4, and Leah's L4 is actually out of alignment. This works out good. Let's go to L5, Leah's sacrum, the right hip, and the left. So these are called our sacroiliac joints, our SI joints. So Leah's right sacroiliac joint is out of alignment as well, the right SI joint. I check outer hips, tailbone. I'm going to go to your sit bone, and then there's a ligament from the tailbone to the sit bone, and that on Leah is also tight on the right side. The last thing I'm going to check is a specific check to see if there's torque and tension on the disc. This does not mean there's a bulged or herniated disc. It just tells me you can relax your leg down, Leah, if there is like a counter rotation taking place. Our lumbar spine, if one vertebra kind of shifts in one direction, the vertebra above or below in the opposite direction, it's almost like wringing out a towel on that lumbar disc. I'm not even talking millimeters. It's just a type of tension that shows up. So with Leah, I'm going to have her bend her knee back up and hold strong, Leah. We'll go to L1 and 2, L2 and L3, L3, L4, L4, L5, L5, and the top of the sacrum, which is L5, S1. That all checks out good on Leah. If someone had a disc issue, if they had pain going down a leg, that 9 times out of 10 shows up. Relax your leg, Leah, and I'll show you what I do to correct that. Very simple, low force adjustment. Basically, I contact the one vertebra above and the vertebra below, and we just work in the opposite direction that tension is showing up, and it relieves a lot of pressure and torque off of the disc, and it can alleviate some of the irritation that's taking place on the nerve that exits out of our spine and goes down our legs. So the next thing that we'll check on Leah are a couple of different muscle groups. There's a few different muscle groups that can be involved with low back pain. So the first one is the piriformis muscle that sits on top of the sciatic nerve. And to do a muscle test for that, I'm going to have Leah bring her foot in. Don't let me pull your foot out towards me. Hold strong. We're just looking for a nice solid contraction there. Then we're going to check the glute muscle. It's a very strong muscle in our body. It's a major hip extensor. It brings our leg back when we're walking. So Leah, bring your knee up and off the table. Don't let me push down on the back of your thigh. Hold strong. That muscle, I should be able to put most of my body weight, relax your leg down, on that muscle if it's in good shape. Relax there. So we would do the same two tests on the opposite side. Next, I'm going to have Leah lay on her back, face up. And we're going to do a couple of other muscle tests. Now this is for the main hip flexor, which is called the psoas muscle. The psoas muscle attaches to the front of our spine, the front of our vertebra, and it goes through our pelvis to attach to our legs. It's a hip flexor, so when we're walking, it brings the leg up. So with the psoas muscle, I'm going to have Leah bring her leg up, toes out. And Leah, don't let me push your leg down and out. Hold it strong. Good. Strong on Leah. We'll check the outer hip muscle. Don't let me push your leg down and in. Hold strong. Relax your leg down. That's strong on Leah. Bring this leg up. Toes out. Hold strong. And toes in. Hold strong. Now, if any of those muscles were weak, there would be associated reflex points that we would go to and activate them to help wake that muscle up. If they tested a little weak, that really helps, along with the adjustments. Someone get through any kind of episode of low back pain extremely quickly, in most cases, and just gets them on their way. So thanks for watching.